So let's talk about retinopathy of prematurity. I've been privileged to be involved in a vast number of claims involving little premature babies who have become children who are blind due to ROP, retinopathy of prematurity. So what does retinopathy of prematurity mean? It's a condition of the retina due to prematurity, premature birth. What does retinopathy of prematurity involve? It involves the retina, which is your satellite dish, the membrane at the back of your eye that is covered in photoreceptors, little nerve endings that absorb the light and take the message to the back of your brain, where it gets processed, turned right way around and interpreted by your brain, so that your brain can give you all of the feedback and interface with your environment visually. What happens to premature babies, and why do some of them, and certainly not all of them, but some of them, develop ROP? When you're in the womb, conditions are very controlled. You're in a fairly low oxygen state, and your retina has certain growth factors that operate in this low oxygen state. Once you're born prematurely, one of the first things that happens is you're now in a completely different environment with a different oxygen mix or different gas mix. And often, because your lungs are immature, you need to get help to breathe, whether it be ventilation or additional oxygen. And because you're born prematurely, you're susceptible to perhaps developing sepsis or developing other conditions. And all of these factors play a role in this growth factor in your retina being able to develop the blood vessels that need to grow, because when you're 24 weeks, you've only got blood vessels right in the middle of your retina. And when you're born at 40 weeks, those blood vessels have grown all the way to the periphery, to the edge. So when you're born at 30 weeks, your blood vessels haven't covered the back of your retina. And in this different environmental state, you must now compensate for that. And sometimes the retina can't compensate for that. And the blood vessels start growing differently. And they might stop growing in an area, and your retina develops a certain condition, and that can cause the blood vessels to grow back and push the retina away from the back of the eye. And if this condition is allowed to progress, it can cause the retina to pull away from the back of the eye and fold up and not function at all. And that's stage 5 ROP, and that's not retrievable. So once that happens, you can't see anymore out of that eye. So what does medical science know about ROP that enables the prevention of blindness due to ROP, that enables the doctors to avoid this from happening? So first of all, they know that too much oxygen is harmful. Now, how do they measure too much oxygen? Well, you'll all have experienced having a little pulse oximeter put on your finger, and the pulse oximeter has a little sensor that determines how much oxygen is in your brain, how much oxygen is taken up by your hemoglobin in your blood. And if that saturation is very high in a premature baby, it can cause complications in the development of the retina. So to try and keep that oxygen saturation between 88 and 94%, the moment it gets above 96%, it's potentially harmful to the retina. So that's one of the key preventative measures that when the baby's in the neonatal ICU, to try and keep that oxygen in that fairly tight range so that the baby doesn't have too little oxygen but doesn't have damaging hyperoxia, too much oxygen. So that's the one thing. But as the baby gets slightly older, an ophthalmologist can dilate the pupil, and an ophthalmologist uses a special ophthalmoscope to look at the retina and see how the retina is developing and how the blood vessels are going. And there's a classification system to enable them to see whether there is ROP and how it's affecting the eye and whether it's time to treat or not. The classification system has also been developed to such a point that the doctors know, okay, this is looking threatening, we need to treat, or this is looking okay, or it's likely to go away because it can regress normally. And in most cases it regresses without causing any harm, but often it doesn't regress. And when it doesn't regress and it develops to a certain stage, which is called pre-threshold, it used to be called threshold, which was when treatment would be given. You don't want to treat babies that don't need treatment, but you do want to treat babies who can benefit from treatment. So the ideal mode of treatment was laser, which was burning the areas that haven't been affected by ROP and that don't have blood vessels in, or freezing them. And this is a method that happens, it's transscleral, so it goes through the lens and into the eye, and it burns the back of the eye. So they don't have to, it's not a massive surgical treatment, it gets done while the baby's in ICU. And it's stressful for the baby, but premature babies can tolerate this stress, and it simply just affects the outside of the eye, and it enables the ROP to calm down, and then the blood vessels to then move to the sides, to the periphery of the eye, of the retina. And that, as a general rule, should prevent the baby from developing this retinal detachment that causes blindness. So protocols have been developed. Protocols are guidelines for ophthalmologists and for pediatricians. And those protocols say that a baby should be seen by an ophthalmologist between 4 and 6 weeks of age, depending on how small they were and how young they were when they were born. The ophthalmologist must look at the eye through this ophthalmoscope and then determine at what stage is the development of ROP. Is it present? Is it not present? Have the blood vessels moved to the edge of the eye? To the edge of the retina? And is treatment required? Now, depending on what the ophthalmologist sees, the baby should then be followed up either 1 week or 2 weeks later. Why this variable? Because if the baby has virtually no ROP, but just very few blood vessels that are moving towards the side, then that development still needs to take place. So we wait 2 weeks, sometimes even maybe 3 weeks. But if the development is such that it looks like the retina might be threatened, then surgery must take place within 72 hours. And if the condition is such that the baby needs to be checked a week later, then the baby must be checked a week later, because a delay of 2 weeks may result in the baby passing that point of no return and of damage happening to the retina that cannot be salvaged. So the protocols are there, giving you strict timelines. And why is that? Because medical science has shown that ROP progresses at a predictable rate. So the 4 to 6 weeks first examination is imperative. The 1 week or 2 week follow-up must be done until the baby's retina is fully healthy and the baby can then be discharged. But if the retina isn't fully vascularized, the blood vessels haven't fully populated the retina, then the baby then follow-up must continue. And the reason for that is to make sure that those blood vessels get safely to the periphery of the retina and don't cause trouble. So if those examinations stop too early and ROP continues, progresses, develops, and eventually causes the blindness, then that didn't happen according to the protocol. And the ophthalmologist or whoever didn't convey the message to the mother to come back for a second ophthalmological examination and the third ophthalmological examination, there's negligence. So there's potentially negligence with oxygen, but now the real thing is the ophthalmology, the exams to see whether has ROP developed, must we treat, and then once treatment's taken place, important that there's follow-up to make sure that the treatment was effective and whether retreatment needs to take place. So we look into each and every ROP case because in most instances we find that unfortunately the medical staff haven't done their job. Either there's been too much oxygen or there's been no screening at all and no treatment, or screening has started too late, or the interval has been too long, or there hasn't been follow-up after treatment, and as a result the retina has become so badly damaged that the baby's lost its sight. And I'm going to quote from the World Health Organization, ROP is an avoidable cause of blindness. So if a baby is blind due to ROP, there's most certainly a reason to investigate whether the care was up to standard and whether that blindness was avoidable.